Good morning, and welcome to the osteoarthritis edition of Breakfast Briefings from ACR Convergence 2020 on Saturday, November 7th. I'm your Breakfast Briefings host, Alan Gabowski, professor of medicine at Weill Cornell Medicine and attending rheumatologist at Hospital for Special Surgery in New York. Today, I'd like to highlight abstract 0708, a poster presented by Denise, Baldock, and Casey Zhang, entitled Differences in Treating Knee Osteoarthritis by Clinician Specialty. Now, our current treatments for osteoarthritis are largely focused on pain relief and improved functioning. We really don't yet have any agents that can modify disease progression or disease-modifying drugs in osteoarthritis the way we have them in rheumatoid arthritis. So, although a number of agents are trying to shift towards disease progression, it's also important to understand how the various clinical specialties and physicians and healthcare providers that treat osteoarthritis take different approaches to management. Now, this was a cross-sectional chart review conducted in 2019 among 275 rheumatologists, orthopedic surgeons, primary care physicians with a focus on sports medicine, and pain specialists in hospital and private practices in the United States, encompassing 1,375 patients with osteoarthritis. Moderate to severe osteoarthritis represented about 2/3 of the sports medicine, PCP, and orthopedic surgeons practice, about 80% of pain specialists, and about 3/4 of rheumatologists. With regard to treatment for osteoarthritis of the knee, there were some differences and patterns that emerged among the specialties that were surveyed. For example, orthopedic surgeons had a greater use of nonsteroidals as compared to pain specialists and sports medicine primary care physicians, and their use was significantly greater than rheumatologists. On the other hand, rheumatologists had a higher use of mild opioids and strong opioids as compared to orthopedic surgeons. Interestingly, when considering radiographic progression via imaging, rheumatologists reported a significantly lower patients demonstrating bone erosion compared to all specialties in this cohort. Now, why is this important? Well, what we see is significant differences in how patients with osteoarthritis are treated among the different specialists who are treating that condition. And the management differences may highlight both strengths and opportunities for the introduction of newer agents into the potential modification of disease in patients with osteoarthritis. Join us again tomorrow when we will look at another breakfast briefing attempting to provide you with some significant information that hopefully you will be able to incorporate into your clinical practice for the treatment of patients with osteoarthritis.